So in the video you can see we're removing the thickened hardened skin from around the patient's heels. This patient has really quite thick skin around the heels, and this is built up over wearing enclosed shoes and putting extra pressure on his heels. And then what happens is every summer when he starts to wear his open back shoes like sandals or thongs, the skin dries out, and just like anything else, when it dries out it's more likely to split. So you can see that these splits that we're working on now have quite a lot of dirt in the bottom of them, so it's important that we remove as much of the skin as possible to try and cut right down to the bottom of these cracks. This helps to relieve the pain and also make the heels look a lot better. So the skin thickens up around the heels because there's excess pressure placed on the heel when we walk. So at heel strike, obviously we strike with our heel as we're walking first, and there's a lot more pressure and the entire body weight goes through the skin. So the increase in pressure causes the skin to thicken up, and the thickened skin causes an increased pressure. So you get this positive reinforcing loop where the thickened skin causes more pressure, the more pressure causes thickened skin, the thickened skin causes more pressure, and it just keeps going around and around like that until the skin's really quite thick. Then when the skin dries out on the heels, it cracks and splits, and unfortunately when it splits down to the living skin, it becomes really quite painful as it's trying to pull apart the living subdermal tissue. Treatment for thick and cracked skin on the heels like this is removal with a scalpel, which we're obviously doing now in the video, and then we sand it smooth and advise the patient to apply an emollient or a moisturizer on the heel to help to prevent the cracking. The type of moisturizer we'd usually use on this is a 10 to 15% urea cream, something like Lactol Heel Balm, Calmura, Uriderm, or any 10 to 15% urea cream you can get from the chemist. So from the video you can see there's quite a bit of work in removing all the hard skin from the heels. We just basically move around in a sort of methodical way, remove all the hard skin, try and cut out as many of the cracks as we can right down to the new skin where it's not cracked, and then we'll sand this up and the patient's ready to go. If you're suffering from thick and cracked heels and you'd like to get some treatment, we can help you out at the clinic by removing the hard skin and then applying some moisturizer.